The rate of suspected suicide attempts by poisoning surged for children and teens during the pandemic. So here to talk about this is Dr. Chase Samsel, a psychiatrist at Boston Children's Hospital. Thank you for joining us.
Thanks for having me, Jessica and Sean.
Dr. Samsel, so let's first talk about suicide by poisoning. The research shows that most kids took too much over-the-counter medicine. What else do parents need to know?
Well, I think it's really that this is what most pediatricians and child psychiatrists will tell you, is that we got to lock up all meds in the household, not just prescription meds that many families do, but including over-the-counter meds, pain relievers, allergy meds like Tylenol, Advil, and Benadryl. It's just harm reduction. We need to get those meds locked up.
Okay, let's talk about the new data from the National Poison Data System. And for folks who are just joining us, the numbers here really are alarming. It compares 2019 to 2021. It shows a 30% jump in suicide attempts for kids ages 10 to 19, and more specifically kids ages 10 to 12, who had the biggest increase of 73%. So those kids, we're talking elementary school here. I think a lot of folks are wondering, how young is too young when you're talking about suicidal thoughts?
I wish I could tell you all that this was too young, but it's important for families to know that this is not just a COVID-related or pandemic-related trend. This has been a growing trend for the past 10 years, and it's really, really, really important to be talking about to our elementary school kids as well as our middle schoolers and high school kids. Suicide is now the #1 cause of death for teenagers and tweens. It used to be motor vehicle accidents. Now it's suicide.
Yeah, and you mentioned the pandemic. We know the pandemic was hard on so many of our young kids. So we also know that previous attempts at suicide is one of the strongest predictors of death by suicide. So even though the pandemic is over, what kind of support do these younger children still need?
Well, we don't have enough time to talk about all the inequities in mental health and all of the biases and stigma that go on. We need so many more clinicians, so many more programs, but starting at home, it's talking about it to young kids. It used to be that there was a drug, sex, and rock and roll talk that people would have with their kids, and now it probably needs to be drug, sex, and suicide talk that we need to know, and kids need to know that sometimes they have impulsive, overwhelming feelings. There might be a breakup or bullying or some upsetting news that they need to talk to their parents and loved ones about, because those are fleeting feelings. It's not just kids that get depressed that do these things. It's kids that get overwhelmed, and we just have to start talking about it to kids to stay ahead of it.
Yeah, it's a hard conversation sometimes too.
Absolutely. Dr. Samsel, thank you so much for joining us and for your insight.
Thank you.
And of course,
appreciate it.
We also do have some important information for our viewers. If you do need to talk to somebody about suicide, you can contact the nationwide hotline. That number right there on your screen, 988. The Lifeline provides free services, confidential and emotional support there 24 hours a day.